So I'm Catherine Grossman. I am the Director of Clinical Development at Biohaven, and I will be presenting on behalf of Dr. Jason Lerner, who unfortunately had a family emergency yesterday and had to fly out urgently. And he sends his apologies and regrets. And I know many of you know him, and he's very fond of this event and connecting with all of you. So he will hopefully be able to be in contact soon. So I will be discussing our investigational drug, BHV 7000. Today, just to give an outline of what we're going to talk about, we're going to talk about who Biohaven is, what is BHV 7000, the overall development plans for that drug, as well as the preclinical and our phase 1 data, as well as a focal trial and a generalized epilepsy trial, as well as the potential of a DEE trial in the future. And we'll also provide some contact information. Jason, of course, has a very close tie to the epilepsy community. He had planned on sharing some pictures and likely stories with all of you, so I wanted to keep those in for him and you guys to enjoy. Here at Biohaven, our motto are days matter. We want to get the science proven and out to the patients to make a difference in our patients' lives. We have a very exciting pipeline with many different mechanism of actions with clinical indications. You can get more information on our other indications and investigational drugs from our website, or I'm happy to discuss more offline after the talk today. So first, let's address the significant unmet needs for the 3.5 million patients living with epilepsy here in the U.S. A third of those people have refractory despite treatment that are available with the anti-seizure medications. Throughout this talk, I will refer to those as ASMs, as well as surgery options and diet modifications. 80% of the patients do experience the burden of adverse events, which make it very difficult for them to have quality in their life when they're struggling with getting control. Most often, patients complain about somnolence or sleepiness, dizziness, cognitive dysfunction, as well as mood disorders. In the realm of ASMs out there today, there's many drugs with mechanism actions that include sodium channel modulators. You probably are very familiar with carbamazepine, as well as my mind is going. Then there's the GABA and glutamate modulators, likely familiar with the benzodiazepines, the calcium channel modulators, like pregabalin. There's a missing puzzle piece here, and that's the potassium channel modulators, and that's where we're excited to bring in BHV 7000, which we believe will be well tolerated and an efficacious ASM with a novel mechanism of action. As you likely know, seizures come from hyperexcitability of the imbalance between the inhibition and the excitability of neuronal cells. And so with these potassium channel modulators, the regulation of the potassium or M current can help regulate this hyperexcitability state. And 7000 was actually developed and discovered by our own Dr. Stephen Degwarski, and it's very dialed in to hit specific potassium channels and decrease the hyperactivity that will hopefully protect from seizures. So When we talk about the potassium channel modulator mechanism of action, it is not new in this space. A few years back, you might be familiar with ezogabine, which was on the market from 2011 to 2017, and it was very efficacious, and patients were getting really good treatment effects and stability. However, unfortunately, only 6 years after being on the market, it was showing some side effects with phototoxicity. And here in this picture on the left shows the discoloration in fingernails. People were getting discoloration in skin, as well as retinal deposits and causing vision dysfunction. So unfortunately, it was discontinued and no longer available, which was very upsetting to epilepsy community since it was efficacious. There is currently another company, Xenon, that is also investigating a potassium channel modulator. They are currently studying their drug, and here the one study that we're referencing is their XEN1101, and it is similar to ezogabine as far as GABA A receptors, which are believed to be responsible for the somnolence and the fatigue and things that cause the CNS adverse events. What's really exciting with BHV 7000 is it was strategically designed to dial out that GABA A receptor activity, and we believe that it will show greater tolerability with less CNS side effects. Here on the right side is a picture depicting the therapeutic index. The upper box is our BHV 7000, and the lower box is comparing it to ezogabine. You can see in the BHV 7000, we have a very large therapeutic index, greater than 40 times, where ezogabine, it was very narrow, less than 3 times. So, given our preclinical data, we were very excited from our phase 1, our safety index with our preclinical data. It was exciting to go into our phase 1 SAD-MAD cohorts. For those of you who are not familiar with these terminologies, it's a single ascending dose as well as a multi-ascending dose study cohorts. It was fairly well tolerated with a really good safety profile. There were no serious adverse events. There was no severe treatment emergent adverse events. And the remaining treatment adverse events were generally mild in severity. The dosing in the SAD cohort was single doses up to 100 milligrams. And in the MAD cohort, there were multiple doses up to 40 milligrams daily over 15 days. Over here on the right side shows a adverse event table with the placebo against our BHV 7000. You'll note that the placebo had 15 participants in its cohort, and the BHV 7000 had 46 participants in the cohort. And you can see we have very low numbers of adverse events across those preferred terms. With that phase 1 study, we're not seeing the typical CNS adverse events that are typically observed with many of the other anti-seizure medications. Again, 80% of patients report having some type of adverse event after starting an ASM. Many of them are attributed to the GABA A pathway, causing those CNS effects of somnolence, dizziness, fatigue. Here on the right, we do a comparison with Xenon, who has investigational drug with a potassium channel modulator, and we compared our CNS profile with theirs in our MAD studies. And you can see that we do not have any cases in this phase 1 study of somnolence, balance disorder, dizziness, memory impairment, sensory disturbance, or speech disorder. So we're hoping for the potential and promising less burdensome adverse event profile for BHV 7000. So here is, so from the data from our biomarker EEG study, it was confirmed that CNS activity was consistent with effects observed with other ASMs. Here we use a heat map depiction topography, changes in the EEG spectral power with treatment with BHV 750 milligrams. There are clear differences where there were observed increased spectral power in all bands across all head without any distinct topography. Together with the preclinical data and the favorable safety and tolerability profiles seen in our phase 1 SAD-MAD study, these EEG results highlight the robust potential of an anti-seizure efficacy. So with all that data, we're very excited to be launching our phase 2-3 studies in focal refractory epilepsy as well as general epilepsy. Our focal study will be named RISE, and we loved our little bird there. It has F shape with its wings for focal, and we are going to be calling our generalized study SHINE. Our goal is to stop seizures, but to do it with minimal adverse effects to improve the quality of life of patients with epilepsy. So our focal trial will be a multi-center randomized double-blind placebo-controlled study to evaluate the efficacy, safety, and tolerability of BHV 7000 in subjects with refractory focal epilepsy. The inclusion criteria will include people ages 18 to 75. We are hopeful to expand that to adolescents of 12 to 17 in the near future. We would, like the participants, must have focal epilepsy diagnosis at least 1 year ago and have an average of 4 seizures per month. They must be on 1 to 3 anti-seizure medications, as well as additional diet or devices. The treatments need to remain stable while on study, and it is required to keep an e-diary and attend the scheduled assessments of the study. There will be an 8-week observation period, and the randomization will occur to a 1-to-1-to-1, either to BHV 7025 milligrams or 50 milligrams or matching placebo. It will be a 12-week or an 8-week double-blind treatment period following this observation period, and people who successfully complete the study will have the option to enter an open-label extension. And we are also, hopefully at the beginning of next year, be ready to launch a multi-center randomized double-blind placebo-controlled study to evaluate the efficacy, safety, and tolerability of BHV 7000 as an adjunct therapy in subjects with idiopathic generalized epilepsy with tonic-clonic seizures, with an option with open-label extension. The safer study design for patients with generalized tonic-clonic seizures with a time to treatment design. In the double-blind treatment, subjects with 0 to 1 seizures will continue through the entire double-blind phase before they are able to enter the open label extension. Subjects that have up to 2 seizures will stop the double-blind and have the option to join the open label. So with that, I encourage you to stop by our booth, 301 to 302 here at the event. Visit our website at biohaven.com or send an email at anna.collins@biohavenpharma.com. And with that, is there any questions I might entertain? Thank you both for coming and listening to our speech, and I will let Jason know he was missed.